Hi everyone, this is Dr. Priyanka Mehta, gynecologist and women's health expert. Today I want to talk to you about a very important topic and a very common problem which is being faced by young girls, by women and even by older women, and that is called urinary tract infection or UTI. So what happens is, if you are just going to understand the normal anatomy of our bodies, the uterus is a structure which is in the center part, as you can see here, and in front of the uterus we have this structure which is called the urinary bladder. Now this urinary bladder, the urine collects in it as we drink water after getting filtered by the kidney, and then it has to come out of this part called the urethra. Okay, and similarly, this is the behind the uterus is the intestine, the large intestine, which ends as the rectum, and then the inner canal. So because we are going to be talking about urinary tract infection, I can tell you that many people think that if they are using different kinds of washrooms, then they may get the urine infection. But do understand that this bladder is having a lot of capacity, even up to 1.5 liters of urine, also 2 liters of urine also you can store till you really start feeling uncomfortable to pass out the urine. So what happens is that the most common cause of urinary tract infection normally for women is when they don't drink enough water. So you're not drinking enough water, the urine which is formed in the urinary bladder is very concentrated, and then when you don't drink enough water, there could be chances of a very concentrated thick urine being there. And if there is any infection, which sometimes is a bacterial infection which can happen from your own body also, that infection becomes very severe because this urine just stays there for a long time. So the important point is that you have to understand that you need to pass urine at regular intervals, and for that you need to drink at least 3 liters of water per day. If you don't drink this much of water, then your urine is very concentrated and you may actually get this infection very frequently. Another reason is when you are not maintaining proper hygiene in terms of when you are washing after you are passing your defecation or passing motion. You need to wash from front to back, because as I showed you in this picture, the rectum, the portion behind the uterus, which is the intestine as it ends, that is the rectum, and the anal canal. So if you're going to wash from back to front, E. coli and many other bacteria which are present in our bodies can get collected into the vagina or into the urethra, the part which passes the urine. And because of this, as you see here, so this is the end of the intestine. So bacteria from here can go either into the vagina like this, or it can go into the urethra or the urine tube, which is just around 4 centimeters. So that is the reason women are more prone to get the urine infection, because the urethra, as we call it, is very short. It is just around 4 centimeters. So they have to ensure that you are drinking at least 3 liters of water every day. And when you're drinking water, don't try to hold your urine for a long time when you feel like passing. So every 3 hours or 4 hours, when you feel like passing urine, you should empty your bladder, because the first sensation to pass urine will come at around 500 ml. And at that time, if you control that urge, then the next surge will come only when almost double or 1.5 liters of urine is collected. So when you collect so much of urine in your urinary bladder and then you pass your urine, then the bacteria which are present in less numbers will keep multiplying and more number of bacteria will infect you. Another reason could be if you are immunocompromised or if your immunity is less. Say during pregnancy, urinary tract infection is common, and also in women who are either taking a lot of high content of sugar, or those who are diabetic. So if you are diabetic, frequent passage of urine could be the first symptom, and you may also get frequent urinary tract infection. So please understand that drink lots of water. If you are getting recurrent urinary tract infection, or you're having pain when you're passing urine, or you're having lot of discomfort as you're passing urine, or it is burning when you're passing urine, or urgency, as we say, as you pass urine, again you feel like an urgent sensation to pass urine, there is lower abdominal pain, you're not comfortable when passing urine, or there is blood in the urine, do meet your doctor urgently. They will order for a urine routine test and a urine culture test, and only after you get the urine culture test we will know if there is a significant bacterial infection or any other kind of infection, and we will suggest the antibiotics accordingly. Don't do the self medication, don't take over the counter medicines or over the counter antibiotics, because these will not treat the infection completely. Some infection will be treated, but it is not a total eradication of all the infection, and then you may have some symptom relief for some time, but then this can actually cause more problem, because again there could be a recurrence of the infection, and an incomplete treatment of the infection will cause more harm than good later on. Some women, in fact, if the infection becomes very severe, all of this infection will travel up from the bladder, the urinary bladder. It can go up to the kidneys also, causing something called pyelonephritis, in which pus can collect in your kidney too. We find such cases commonly in pregnancy, especially when there is diabetes also associated, because there is immunocompromised state or pregnancy, the immunity is less, so there are more chances of this severe urinary tract infection in pregnancy. So do ensure that you're drinking 3 liters of water, you're using the washroom regularly, you're maintaining proper hygiene when you use the washroom, you're going to wash front to back, you're going to wash your hands before and after using the washroom. During your menstruation, ensure that you change your sanitary pad or napkin every 3 to 4 hours. And even when you go out, there is no harm in using the washroom, because controlling urine for a long time can actually predispose you to the urinary tract infection. And once you have an infection, don't self-medicate. Do a proper urine routine test, culture test, and meet your doctor, and accordingly, depending on the culture report, get the treatment. So thank you, and take care.